Hi, I'm Dr. Julie Steinauer, and I want to spotlight a patient's record for you today because it comes from some questions that I've been having recently, actually a lot, in email from patients finding us online. And this case really, I think, covers a lot of those questions. So many of the questions that I'm getting is, how can you decrease someone's LENS prescription so much? Um, how does that affect them if they have an eye turn, and what does it do to affect their eyesight too? So we're going to use a patient profile case and kind of go over that. So when this little guy came to see me, he was 6 years old. I can show you what his functional visual field looked like initially, and it was really tiny. So that's about the size of a dime, and part of it was just a little bit larger. I'll show you the end result, which is really cool and a lot easier to see. Whoa, right? So the end result was something fantastic. His functional visual field was much larger, so that was really amazing. But when he also came to see me, he saw 20/60 with his right, 20/50 with his left. He was about plus 3 1/4 for anyone who tunes in and knows what those numbers mean. About 3 1/4 in terms of farsightedness in his right eye, and about 75 cents in his left eye. And so what we did was we took his prescription down to just a little bit of positive power at the top, and we gave him a bifocal that had some power in the bottom, kind of like what you see for someone who's maybe over the age of 45 or 50 years old, a bifocal. But it works really well in kids, and we took him from being a 3 1/4 down to just reading only glasses by doing that. And we took him from 20/60 and 20/50, because he was amblyopic, down to 20/25 in each of his eyes. He also came in not having normalized depth perception, and so he was only able to see this large fly on the stereo vision or depth perception test, which equates with these little circles to this very first one here that you can't see unless you had on those special goggles. But it's the same, this one is the same as the amount of depth that we see over here. By the time that this little guy left us, not only was he not amblyopic, 20/25 in each eye, wearing only glasses for reading and near work, but he also had normalized depth perception. So I hope that answers some of the questions that we've been getting a lot of, like, how on earth do you do all of this? Well, it's magic. No, there's actually a good process for this, and it really involves us using photosynthetics light therapy and vision therapy. If you have more questions, then go to our website at visionforlifeworks.com to learn more about what we do. If you're local, call us at 618-288-1489, or you can start the process and find out, would you be a candidate to do this type of treatment with us, by going to our website and filling out the quality of life questionnaire. Now, if you're a doctor or a therapist, we have a really cool group called Next Level Vision Therapy. Go check us out on Facebook. Thank you.